There's no denying that Kris Jenner sits at the top of the tier when it comes to celebrities who defy the rules of aging. The Mominger and Keeping Up with the Kardashians star looks better now than she ever has, at the tender age of 64. The proud mother of 6 has raised the most successful and talked about children on the planet, and she has kept herself looking youthful and sprightly all the while. But how has Kris managed to look just so spectacular for all these years? She's previously admitted to having breast implants and neck lift, but the entire Kardashian clan are notoriously very secretive about all the plastic surgeries which they might have had done to alter their changing appearances. This has left many fans wondering how 64-year-old Kris has managed to keep her youthful glow. According to cosmetic expert and surgeon from Glow by Maya Cosmetic Surgery, the reality TV star has most probably underwent many different surgical and non-surgical procedures to keep her looking FRSH. The expert told the Mirror Online, would suggest that Kris has had range of surgical and non-surgical procedures over the years, some to help maintain youthful appearance as well as change some of her physical features. When it comes the starlet's ever-changing nose, it would seem that Kris has had more than one surgery, as it appears to have gotten increasingly thinner and smaller down through the years. I would suggest that Kris may have had rhinoplasty, the surgical name for nose reshaping surgery procedure. The bridge of her nose appears thinner, and the tip and nostrils appear to be smaller and slightly lifted compared to previous images. As well as this, the Keeping Up with the Kardashians star may have decided to reduce the size of her nostrils after famously admitting that she hated them on the 15th season of the hit TV show. The cosmetic expert explains, the surgical procedure of reducing the size of the nostrils is called an alar base reduction. Nose changing shape in such way could only be achieved through surgery rather than contouring. Kris is said to have forked out hefty cost of £10 pop for each rhinoplasty procedure, as the surgeon explains that she has more than likely had several operations to change the defining features of her nose. It's also possible that Kris has had more than one rhinoplasty, as the nose does appear slightly thinner in recent years. Occasionally, patients find the desired result was not achieved and feel they need another operation. As mentioned previously, Kris has revealed that she underwent neck lift back in 2015. Our expert surgeon says, Kris has spoken openly in the past on an episode of Keeping Up with the Kardashians around having neck lift. The scarring following the procedure is normally hidden around the back of the ear to keep it discreet. When it comes to her breasts, Kris has been very open about the procedures she's had done. The cosmetic expert reveals that it's possible that Kris had an augmented matopexy, more commonly known as an uplift with implants. This procedure can typically range from £6, £508, In terms of non-surgical treatments, the Keeping Up with the Kardashians star is highly speculated to have fillers in her cheeks, chin and jawline. Dermal fillers can be used in this area to reintroduce structure and volume along the cheekbone, just like in Kris' case. The procedure replaces soft tissue whilst filling in wrinkles. Skin folds and fillers can range in price depending on the area and amount used, between £150–500 per session. Our expert states, believe that Kris may have undergone the non-surgical treatment of fillers to her lips, as she appears to have slightly fuller lips compared to previous images. The provider has ensured her lips still appear extremely natural and in proportion to the patient's facial features. Kris' eyes also appear brighter and her eyebrows seem to have been slightly lifted throughout the years. This points towards the non-surgical treatment of anti-wrinkle injections, which is also known as Botox. Kris has most likely had Botox to her forehead and glabella, in between the eyebrows. As you can see, she has smooth forehead, lifted eyebrow arches and limited frown expression. The treatment normally lasts between 3–6 months, and as muscle action gradually returns, the lines and wrinkles begin to reappear and need to be treated again. The procedure can give the appearance of smoother skin if you are after youthful appearance, or can be used as preventative measure to slow the process of getting wrinkles. Looking good. Kris